Thank you very much. No, we really appreciate it. No, thank you very much. You've done a lot, eh? Thank you very much.
It goes without saying that this COVID-19 pandemic will continue. And it will have a big impact on our personal lives, on our priorities, on the way we do business as well. And as Bamburi Cement Group, we applaud and support all the efforts of the Kenyan government in curbing the spread of the pandemic. As a key player in the building material industry and construction industry, we acknowledge that we have a central role to play in supporting individuals and the economy during this crisis. And we will do all what we can in facilitating rapid and sustained economy recovery. Our community support initiatives has also been aligned to the health and safety pillar. So since the announcement of the first confirmed case in March, we have been working closely with our partners to support local vulnerable communities within our areas of operations in Mombasa, Kilifi, Kwale, Machakos, Kajiado counties. We have so far successfully distributed water tanks, sanitizers, and face masks worth 2.4 million shilling. Some of the communities we have supported the other communities in Matuga, Kwale County, and we appreciate the partnership of the County Commissioner Office in mobilizing the community.
Corporates and individuals, we are now at about 2.8 billion. We haven't moved much from that number, so we encourage more people to come on board. But what we've really done well of late is to start spending the money. So as you've been seeing throughout the last 2 weeks, we are distributing PPEs across the country to the designated hospitals to deal with COVID. And we've promised the country we are going to spend 1.4 billion shillings in PPE, and this in buying PPE, and we think this is enough for the next 18 months. We also started distributing masks for the vulnerable communities. We have about 1.3 million cloth masks, which will be distributed from last week and in coming weeks. We've also started training doctors. Remember, we are supporting doctors in psychosocial support. As you can imagine, it's a very stressful time for them. And then lastly, the other thing we are doing, which is also very important, is to give the vulnerable people money. Each week, we are distributing 100 million shillings to 100,000 families, mostly in Nairobi, and we'll do that this month. And of course, food distribution continues.